Shodaje, the Messengers for Health program has been providing cervical health education to the Crow Indian women to empower them to take good care of their health and receive regular cancer screening exams. Our program has developed this video for providers so they may learn a little bit about the Crow culture and better understand and communicate effectively with their patients. Thank you for taking your time to view this presentation. Aho.
Do you feel free to share about any experiences that you've had at IHS, and the way that as the provider treats you and cares for you that you felt good about? And so just feel free to share anything that kind of comes to your mind right now.
Well, I like it when a provider cares about me, just by the way they interact when I have an appointment.
Tobacco to the 4 directions. Bola, milchave lit detail. Mouse lit detail. Bola, jag. You all give, no access. Here Apsáalooke. In order for me to make a prayer to God, the Creator, the Grandfather, I have to pity myself and make an offering to show that I come in respect and to talk one-on-one, to let the Creator know what comes from my heart. One of the blessings that I asked the Creator is that He would help us find a cure for diabetes, cancer, drug addiction, alcohol addiction, and the other various diseases that are among us here on this reservation. And that we would have some doctors that would come and help us learn more, maybe help us with a cure. Everything that I have asked for, it concerns the earth. All the cure, maybe it's a plant, maybe it's a root, maybe it's a mixture of both. Maybe it's around here, maybe it's somewhere else. And I asked the Creator to help us find that cure. That's what I asked for. To give people the wisdom to make decisions that affect all the people's children, the ones coming.
Akbali'a Balehawase I'tchiok.
I used to go berry picking with my great-grandmother, Lizzie Yellowtail. In the summers, we'd go up in the mountains. We'd all get together, and sometimes my grandmother, Agnes Deernose, would be there too. And some of the other cousins. We'd go and we'd go through the mountainsides and pick berries and buffalo berries, chokecherries, juneberries, sarrausberries. And then we'd bring them down and clean them, and they were prepared in different, like choke cherry syrup, pemmican, and then sometimes my great-grandmother and her sister, I remember, would grind the berries, and then they'd lay them out in the sun. They'd make patties and lay them out in the sun and dry them. And that was another way of storing them, and I think this was brought down from generations before. When they were nomadic, they'd dry them and keep them for the winter. And that was a nourishment in the winter for them. It was a treat, it's like having watermelon in the winter, I guess.
The Apsáalooke people relied on the land for survival. And this included the animals, particularly the buffalo, antelope, deer, and we also depended on the land for what it offered, the roots and the fruits, which were the plums and choke cherries and buffalo berries. We utilized the wild peppermint for tea and drank a lot of water. Unfortunately today, as we have transitioned from the traditional into contemporary, our health has diminished, and unfortunately so has how we eat. And one of the things that has impacted highly is, as a nation, is sugar. The introduction of sugar, and that has impeded our health to the point where we have 859 individuals that are diabetic on the Crow Indian Reservation.
One time I got a letter from my doctor saying that I'm not a diabetic. And I was so proud, I showed it to my daughter, and she got mad at me because she was a diabetic. She never got a letter. So I think I really enjoy public health for doing that for me.
During the latter part of the 1950s, the United States government, in its generous ways, have provided certain rations to the Crow people. And this ration is called the commodity program, where surplus food was introduced to members and families of the Crow. And under this arrangement, I think the additives were too overwhelming at the time, I believe, because of the grease, the amount of grease and salt and other nutrients that affect the metabolism and the breakdown of different foods that the Crow eat.
We should go to the plain, natural things that we used to use long ago. And that's what I have in my freezer. It's just berries that I pick and roots that I dig. And the roots that I dig give you health and give you food and medicine.
We exercise our right to go and practice our beliefs, whether it's traditional, whether it's conventional, and we respect each other for that. And so there's kind of a relationship that affects the education or the learning of these people. But we keep going back to the traditional thought all the time. The traditional thought of the Crow Indian people is still the Crow Indian behavior, the culture, the mores of the culture. And we can't seem to get away from that. So that has a lot of bearing on making your decisions on conventional things like making a decision to ask for the type of health services that you want.
My real last name is Rides the White Hip Horse. Jerome Rides the White Hip Horse. Balehawase I'tchiok. Bilga Balehawase I'tchiok. Kaliwi Akbali'a Apsáalooke I'tchiok. Machida Milata to Jerome. Deda Nehiragish ne pe Amario Shkulik ne Shkulik Kabik Bill Kabil Guhan. Yagish Kapak. Today I live in what I call a bilingual world. And during the time when I'm employed in the Indian Health Service in the hospital, which is utilized mostly by the Native Americans. As a Native American, we still believe in carrying out of our traditional cultural way. So this is what we call sweetgrass that's born native in Montana in this area, and we utilize that. And what we do is we burn it. It's no different from the Catholic Church burning a cedar, using in the Baptist Church, in the Catholic Church, cedar in person. And we'll be cedering like this in the room. And we're out evil spirits and evil things, and that's what smudging is all about. And it's purifying the mind and body and the soul and helping the patient get better.
If you choose to practice in a culturally intense environment like we have here, then part of your responsibility as a healthcare provider is to understand that cultural community, to understand the beliefs, what's important to the individual who lives in that community, how their beliefs, their ceremonies, their activities impact their health care. And going just a little bit further with that, I also believe that to fully understand that cultural intensity, you really need to participate in some of the cultural activities that go on in the community.
Daria, everybody please stand. We're going to have the grand entry at this time. We have the United States flag, Crow flag, state flag, Plenty-Coups flag. You need to speak up. We need to work together to help each other for all Montanans. The vision of Plenty-Coups and what he left this land was for all of us to get together. And I think we should all sit back and realize that today.
You don't learn Crow, you live Crow. You live it.
Now these are lodge poles, and we'll get them out of the priors here, out of our own mountain.
My book of colors. Red, Hishya. Blue, Shor. Orange, Shiloja. Purple, Yagaga, Dishijaja. Well, my first language wasn't Crow, but I can speak a little bit, but not that much. But I try my best to talk to my kids, and their dad's a Crow speaker. My oldest daughter can kind of talk Crow, the oldest one in the purple. And their dad's side, that's all they do is talk Crow.
Sometimes it helps to have a translator there. Even if they understand English, it's good to have a relative be there to translate if you can get one that you can, feel is able to do a good job. But it's more than just the language. It's the whole attitude towards why we're here on this planet. White culture, we're here to accumulate as much and be a big achiever and do everything we can possibly do to be successful. The traditional Crows that live here on the reservation, that is not how they value their lives, and that's not their purpose in life, is to accumulate as much material things and be as successful as possible, as fast as possible. They have much different values, so those are things that have to be learned, I think, to deal effectively with the people here.
If my son-in-law was laying sick in the hospital and a doctor came and asked me or wanted me to explain his health or explain something to him. Because of our tribal culture, I can't say his name and I can't look at him and I can't even be in the same room alone with him. I can't speak to him. I mean, that's something my great-grandmother did all my life with her son-in-law. And that was modeled for me. And so in order for me to continue that form of respect, then I cannot discuss my son-in-law's situation with his doctor. How is it for you in being a director and working with new staff that come here, when you have to access information about your patients or clients?
I think the new doctor or the new employee needs to understand that as a sovereign nation, we have our own laws that we abide by as citizens of this nation. And a lot of times we work within a tribe, as my program, which is the substance abuse. We have certain regulations that we need to abide by too. So maybe an instance would be that I need a certain information data from the doctor, and they need to understand that they need to take directives from the tribal programs or the different programs that are within the reservation, not just with Indian Health Service or the state of Montana, but we're different in a sense that we do operate as a government.
A lot of things that we do culturally are a form of respect. And it's something that's been handed down for generations.
With anything that we do, tobacco plays a large part of it. And that doesn't necessarily mean we abuse it, but we use it in a religious way. And I myself is a non-smoker, but if I'm working on someone that comes to me for help, I will use the tobacco because that's one of the gifts that was given to us.
That's where they build the fire at night.
Tradition relates to us that the Crow way of life, or how we exist to be here, is through two chiefs that migrated to Montana. No Vitals, who was the one that migrated us here, he had fasting and vision 4 times. And during the 4th time, that's when he was told that we needed to migrate here. And the story goes that it was hundreds of years before we finally came to this place, the Crow land. And so he migrated and traveled until during the 4th vision, then he saw the Bighorn Mountains. And when he saw in that vision, he went to look for the tobacco seed. And it was at the base of the mountain. And the story is that when he saw the tobacco seed, they were like twinkling stars. And so that's when he said, this is the place, this is where we are meant to be. And so that's why we're here today.
I used to think there was something wrong with me because, I was always kind of getting in trouble for not being on time. But it's just like, if there's someone there that wants to talk to you, that's more important than being on time for an appointment or something. With Native people, time is presence. We don't go by the 8 to 5 time. That the more important thing is to be together and to be with each other and to walk with each other and to be there for each other. And that really kind of cleared up, for me, the importance of my time too. And so, it's really good to be with each other, and sometimes because of the distances we don't get to see each other. And so to be with each other is more important to us
as Native people. It's a healing time, I think, for us too.
When we think about in our Western approach to primary care medicine, for example, we like to have an appointment system where we give people an appointment several months out in advance and expect folks to show up at a certain time on a certain day. And it can be very difficult to understand the challenges to that style of primary care medicine if you've never been to someone's house or been in someone's life, where it may be very difficult to plan from day to day just what you're going to do and whether you're going to have transportation to and from the hospital, whether there's going to be a family emergency that comes up, whether there will be a family member who is in the hospital or whose funeral you need to go to. And I think that we providers have a tendency to get a little frustrated and exasperated with patients who don't show for an appointment. And I think it's one can have a lot more empathy if you've been in someone else's setting for a bit, in their shoes, and seen what life can actually be like and what the challenges are. And I think that perspective is very important for us as we think about how we can serve the community best and how we can deliver healthcare in a more community-oriented way. I think our historical, traditional models that we've been trying and sort of been frustrated with for a number of years need to change, and that we can do a lot better.
There she is. Where did you go? In the back. Did you go examine a patient?
Where'd you take care of your sword?
It was out there.
Okay, it's still out there?
If I had a doctor's appointment, most likely my daughter comes with me. If my mother or my doctor or one of my sisters is with me. So,
when considering a plan of care for a patient, the familial context needs to be considered, and input from lots of different sources needs to be considered and respected. And so I think that's very important. I think that's different than in a lot of other Western settings where things are a lot more individualized and less connected, per se.
A mosquito went and bit this horse fell dead. And I said, what happened over the phone? And I said, oh no. I said, maybe you should go to the clinic right away. And then I said, well, I'm leaving, I'm on my way. And so I took off the Brownie on the way. I turned the radio on and this horse died and that horse died, and I was listening to it. When I finally got to Brownie, it was way late, about 12:30, somewhere around there when I got there. And I walked into my daughter's house, and then my granddaughter was sitting there, and I said, oh, I wonder how Charlene's doing, And then she said, what happened? I said, I don't know. She said a mosquito bit the horse, and it killed the horse, and the same mosquito came and bit her. And she said, but me, I have a mosquito bite. I kept scratching, and she came and looked at it. Go to the ER, she said. Man, I got in the car and went to the ER. There was a lot of people in that ER, emergency room. I just passed by everybody. I just walked in there and I stand right in front of the doctor, and the doctor was looking at me. I said, help! And then he said, what? Emergency. And then he said, what is it? I said, I think I got the West Nile virus. They took me in the room, and I was sitting there, and I said, oh no, I kind of thought. And then that doctor walked in, he said, oh, they're just after horses and crows. I said,
Laughing a lot and heals a lot of people. even if you're sick, and don't feel good. You go over there and talk about humor things and somebody doing something wrong, and you talk about it and you laugh. Like my brother was in his dying bed. He had cancer and he was going to die, and we all went to see him, and he said to his wife, "When I die, you fix your hair and you put your makeup on and run around and you have a boyfriend." And my sister-in-law was really mad. "Don't talk like that." And he said, "No, I mean it. You're young. You better run around and have a bunch of boyfriends."
If I were to give a message to anyone coming into our home, because we consider the reservation our home, it's to learn to know the ways of our people. And the Crows are very open, they're very receptive. They want to help people understand us so that we can also be in balance. One of our beliefs is that right here where we are, this is the center of our universe. And so if someone is coming in, they need to learn.
One guy came and said, "I'm new in this area, so I want to get to know the people around here, but how do I go about doing that?" And so I said, "Well, get some of the local people and go visit the different homes, and you'll eventually get acquainted with them. Then that way you won't be so, they'll tell you, come back or whatever. They won't mind it so much. I kind of feel they're accepted."
How do we deal with an individual that comes from a large metropolitan area to a small, isolated, town? Maybe prior.
What has kept me here for 21 years is the people, my ability to practice medicine to the best of my ability, and an opportunity to participate in their culture and feel part of their community.
Well, how does a person get healthy? What does healing really mean? What does it mean to be healthy? These are important questions, and they're questions that have to be answered within a cultural context because they're based on values. And each of those, each individual has a choice about what values, what virtues they want in their life, what values they're going to espouse. So it's important to understand the culture. It's also important, I think, to try to really think about what health is.
The essence is to respect people's autonomy, respect people as individuals, get to know them for who they are, and enjoy the interaction, enjoy getting to know people.
And everything that we as Crows do, we don't do anything without beginning with prayer or closing with prayer, and so this is our closing prayer to this project. Dear Father, you who create everything, Apsáalooke, we humble ourselves before you today. As of today, we Crows have gone through a lot in these past few months. Today, it's a little cold and cloudy, but it's a day that you gave us. And we are very fortunate to see this day. So I'm asking that you stay close to us, watch over us, and help us. And as I face the east where all new things come, I pray for the unborn ones that we're waiting for. Help them to come to our land in a good way. And as I face the south where the warmth is and all our relatives that live towards the south. They've also gone through a lot. And I ask that you watch over them. All of us, the Crows, and all the other tribes, were experiencing bad diseases that have overcome us, such as cancer, diabetes, alcohol and drugs. You took me to your land, Israel, where I was asked to pray for peace for all tribes. And there you told me that you heard every prayer. I am poor and pitiful, so I'm asking that you hear me today. Show us how we can overcome these diseases. Teach us. Put your Holy Spirit upon the medications that are given to us, and upon the doctors and nurses and in their thoughts, and help them to help us. Allow them to help us to overcome these diseases so that we can continue on. As we look to where the sun sets, take us by our hands and wipe our tears. When we meet, help us to help the different providers so that they can understand us. And pour your Holy Spirit upon the meetings that we have. Help the providers to learn our ways and to take it to their hearts and minds so that they can work with each other and also work with us. Be kind to them. Show them how to heal so that they can take it and use it for themselves. And I say, aho, thank you. Aho. This is